Hi, my name is Dr. Matthew Taylor. I work at Inland Orthopaedics and Pullman Regional Hospital, and we're here today to discuss rotator cuff repairs. Rotator cuff tears happen often. As we age, unfortunately, the rotator cuff tendons begin to degenerate and small tears can become even larger tears, creating pain and dysfunction into a shoulder. Most of the time, that is difficulty reaching out away from your body, lifting things off of a heavy shelf, and causing pain, especially at night. Those could be symptoms of rotator cuff disease. When that occurs, we typically get an MRI to evaluate the rotator cuff to see its size and make sure you do not have bad arthritis. If we do not have bad arthritis and that rotator cuff would improve with surgery, that's typically done arthroscopically. Arthroscopically means through small poke holes around the shoulder, usually about less than a centimeter. Usually 3 to 4 of those are enough that we can do all the work to repair that rotator cuff and pull it back down to the bone, restoring the function to that shoulder. Unfortunately, it is a long process, a long recovery, typically requiring 2 months in a sling after surgery, and then physical therapy typically for about 2 to 3 months. Some people want to know what that anatomy might look like. This is a model of a right shoulder. This is meant to represent the collarbone, the wing bone, and the arm bone. And these are the muscles of the rotator cuff. There are 4 different muscles, and you can also see depicted here the biceps tendon. Those muscles actually come together in a cuff of tissue, and that's why we call it the rotator cuff. The most common rotator cuff tear has a tear in this section right here, pulling away from the bone, leaving a gap. When we do arthroscopic surgery, we leave anchors into the bone and sutures that come out through the tendon, and we tie those sutures down, restoring the natural anatomy to the bone and tendon. Following this, the rotator cuff will all function as one unit and allow for movement of your arm. If you're experiencing any of these symptoms and would like to discuss them further, ask your primary care about a referral to Inland Orthopaedics, where we'll be happy to answer all your questions.